What late side effects can radiation therapy cause? Imagine going through cancer treatment and then facing surprises months or even years later. Radiation therapy can leave behind effects that show up long after your treatment ends. These are called late side effects, and they happen because radiation can sometimes damage healthy cells in the area treated. The specific effects depend on which part of the body was treated, how much radiation was used, and your overall health. If the brain was treated, you might notice memory problems or feeling slower mentally. Some people experience symptoms similar to a stroke, like weakness or difficulty speaking. There is also a small chance of developing tissue death in the brain, known as radiation necrosis, which might require further treatment. Some patients may develop hair loss, hearing issues, or cataracts if the head or brain was involved. For those who had radiation to the head and neck, dry mouth is common because the salivary glands can be damaged. Changes in taste, difficulty swallowing, or sores in the mouth and throat might also occur. Tooth decay can happen faster, and swelling in the gums or neck is possible. The jaw can become stiff, and the thyroid gland might not work properly, leading to hormonal issues. Sometimes the jawbone can suffer damage, which is called osteonecrosis, and it can cause bone death in the jaw area. When radiation targets the chest, there is an increased risk of heart problems later in life, especially if chemotherapy was also part of treatment. For those treated during puberty, chest radiation can raise the chances of developing breast cancer in the future. Radiation to the pelvis can cause changes in bowel habits, like looser or more frequent bowel movements. Bladder capacity might decrease, leading to more bathroom visits. Women who had pelvic radiation could experience vaginal dryness or fertility issues. Skin and soft tissues in the treated area might change in texture over time, possibly leading to scarring or long-term skin changes. Fatigue is another common late effect, and it can linger 4 months but usually improves gradually. Some late side effects might get better on their own, but others can be permanent and need ongoing care. It's important for families and caregivers to stay alert for new symptoms long after treatment ends. Communicating any concerns to the healthcare team is key. Knowing what to expect helps families support their loved ones better. Because late effects vary based on the treatment plan and personal health, caregivers should ask the medical team what specific effects might happen and how to manage them. Being aware of these potential issues helps families provide the right care and seek medical help when needed. In the end, understanding these possible late effects can help everyone involved stay prepared and proactive in supporting recovery and quality of life after radiation therapy.